We're going to start by just assessing. So first, let's just bring ourselves into the space that we're in, into our bodies, by just breathing. And not just our normal breaths, which tend to be chest breaths. I want you to go ahead and actually breathe down into your belly. From there, you're going to go through little head movements. So maybe 5 to 10, trying to touch the chin to the chest, not forcing that or any of these movements at all. These are again meant to just be assessments. Then you're going to tip the head back. Notice if there's any tension, if there's any tightness, if there's an inability to bring the head back. Once you've done a few going back, you can then start to make your way left to right. Notice if one of the shoulders rises as you turn the head one way. Do you feel strain as you turn the head the other way? Is it easy to turn the head one way and more difficult to turn it the other? Again, just assess. For this one, you're going to want to have your arm at a 90-degree angle and pull the shoulder back, open up the palm, have the palm face the ceiling. You're trying to look at your shoulder and belly breathe. You should feel an amazing stretch somewhere along the neckline, maybe down the front of the arm. Once you've taken your breaths right there, you can then go through some rotations with your head. None of this should be forced. It should be relatively smooth. If you're having any significant pain, you should minimize the movement. If you need to intensify the stretch, you can go ahead and extend the arm out. Again, keeping that neck nice and long and reaching the ear towards the shoulder. Now you're going to take a moment to reassess. You're going to see if your mobility has improved at all after doing that first bit of movement. So again, just trying to nice and easily bring the chin to the chest, tipping the head backwards, and then also trying a side-to-side twist of the head, a turn of the head. If there's still tightness, don't worry about it. This is usually a practice that is going to take some dedication in order to see some improvement, but then again, sometimes we do see an improvement right away. We're then going to go into some little kind of slides of the head. So think of sliding the top of your skull along your vertebrae, along the very top of the vertebrae. So you're going to try to push the chin forward and then pull it back, giving yourself a super flattering double chin. Once you get this down, you can try circles with the head. I've sped this up a bit, but give yourself about 5 or 10 minutes per side of your spine, and you're going to place the lacrosse ball right by the bottom inside corner of your scapula. Minute by minute, or however long you want to sit with it in each spot, you will start at the bottom and work your way up towards your neck. You'll see here that I'm bringing my arm through a range of motion. This might not be possible. It might be too painful. Do what is suitable for you. If you can, you're trying to soften around the lacrosse ball. You're trying to breathe into your belly. You're trying to relax as best you can in a situation that is, to be honest, sometimes very, very painful.